Admin. Only office managers or those with office manager privileges will have the Admin tab. By clicking on the Admin tab, the office manager can register with network partners, set up the disease management program, and manage their practice. Network Partner Administration. By registering with the network partners listed on the network, any diagnostic test results from those facilities listed will be sent to the ordering physician electronically. Once the results have been reviewed, the physician can forward the results to other healthcare providers on the network, or they can forward them to the patients. Once you have registered with the network partners, it is important that you designate which staff members will have permission to receive and view the diagnostic results. To do this, simply click on the account name or the account number, then click on the Workflow Management and choose the eResult Management from the drop-down box. Then simply click on the appropriate box to designate which staff member classification is to receive the results. In the event that there are exclusions, by simply clicking on the staff member's name and then clicking on the arrow over button, that specific staff member will be excluded from receiving any diagnostic results. You may also access this feature from the workflow screen. Once you have made your changes, always click on the Save button or the system will default to its original settings. Disease Management. The disease management model is designed to assist the physician in managing specific patients electronically. This feature provides the primary care physician with the ability to set disease-specific parameters to better help manage the care of their patients. By giving a patient access to the program, the physician is able to track the patient's disease-specific results such as blood pressure or blood sugar measurements. For instance, if a patient is signed up under the diabetic program, the physician sets the parameters that he or she wants the patient to remain in. As the patient enters in their blood sugar results, the physician is notified when the readings are outside the designated parameters, and the patient is directed to contact the primary care physician for further follow-up. In addition, the physician is able to electronically review the patient's results periodically from their computer portal. Practice Administration. Under the Practice Administration section, the office manager has the ability to oversee all aspects of their practice profile. To the left side of the page, you'll find the practice profile. From this page, you can verify the practice name and tax ID number. By clicking on the Update button, you may change any of the information as indicated. Under the practice profile, you may also review any of the information assigned to your staff members. Under the Workflow Management tab, you are able to assign specific tasks to specific staff members. By simply clicking on the box under the Tasks tab and saving the changes, you can, for example, assign medical records requests to as few or as many staff members as you wish. By simply clicking on the staff member's name, you gain access to the Managing Staff page. Under the Managing Staff page, you are able to view and edit your staff member's demographics page. To show an individual as inactive, simply find that staff member under the drop-down list and click on the Inactive box. Once a staff member has been made inactive, they can never be made active again under that same username. From this page, you can change the spelling of their name, list their staff title by using the drop-down box, designate a primary practice location that they're associated with, enter in any email address, mobile phone number, or pager number. From this page, you are able to designate what security roles the staff member is granted. By simply clicking on the role desired, clicking on the arrow over to the right button, you can update their roles as necessary. In the event that you wish to decrease their security role, by simply clicking on the role to be removed in the right-hand column and clicking on the arrow over to the left button, their role has been reduced. Whenever making any changes to a staff member's demographic page, please don't forget to save your changes. You may also update their biography if desired and update their user settings for email notification, message sound notification, pop-up notification, fax notification, and their inbox preview pane. Once you have made the changes desired, click on the Save button or the system will default to its original settings. In the event that you have multiple practice locations, by clicking on Manage Locations, you may update any necessary information. This information will populate the demographic information found on your practice profile. To add a new location, click on Add New Location to the left of the page and complete the required fields and save your changes. If you have sponsored patients on the network, you can set up health information websites that you have found to be safe and helpful. Under the Patient Management, you can also set up the types of messages that you want your patients to be able to send to your practice. Also, under the Patient Content tab, you are able to determine the level of direct contact that your patients have with the physician. Under the Add or Remove Premium section, you are able to indicate if your practice will offer your patients the basic or premium level of patient-to-physician communication. To upload a photo, click on the Upload Photo tab, browse your computer, and attach a photo in the same manner that you would attach a file to a general message.